or your break. Yeah, today um, we have the open and aware, and it's a brief method of acceptance and commitment therapy. There will be a few places that will be doing some exercises. You do not have to worry about sharing anything. This will simply be something that you can do within your own space. Okay, now let's kind of jump right into it. Before we get started, I actually want to do a mindfulness exercise. I would ask everyone grab a pen and paper, or you can use your phone. And I actually want you to jot down anything that comes to your mind presently. We kind of just want to see what is present in terms of thoughts, feelings, or emotions. Even if you have any physiological sensation showing up for you, feel free to jot that down. Now, you will not be sharing this. This is simply just to notice what is there in the moment. I like to think of these mindfulness exercises as a time to listen to our brain just for a brief few minutes before we kind of allow ourselves to be present with whatever we're going to do in this moment. So again, I'll give everyone about 4 to 5 minutes. Go ahead and just jot down what's showing up for you internally. That includes thoughts, feelings, emotions, or any physiological sensations. I think I mentioned this, but you will not be sharing this in the chat. This is simply for you. Okay. All right. Now let's kind of get the ball rolling. So this is a brief outline of everything we'll be going over today. So just brief history, then the main philosophy of ACT. Then we'll kind of briefly go over the hexaflex. We'll break down the three pillars, and then we'll go into detail on the open and aware pillar. And then we'll spend some time with the mindfulness exercise that you can use with the client as well. Um, this is just some very brief history to give some context to describing behavioral therapy. Um, Again, this is meant to be very, very brief. So in the mid 1900s, we have what was known as kind of like the first wave of behavioral therapy. So think of Skinner, and it was also labeled as behavioral therapy. Then in the 80s, even 2000s, we have what is considered the second wave of behavioral therapy. So that includes Aaron Beck's cognitive therapy and then cognitive behavioral therapy. And as you can see, between the first and second wave, they kind of build on each other. I kind of think of it as a derivative, as a reaction to the previous one. And then with the third wave, we kind of have a multitude of different therapies. They actually don't have any specific underlying attribute similar to the first and second wave of behavioral therapy. But within that third wave is acceptance and commitment therapy. And the thing about acceptance commitment therapy, better known as ACT, it considers the contextual nature of thoughts, feelings, emotions, and even physiological sensations. Often we call these thoughts, feelings, emotions, physiological sensations, inner experiences, internal experiences, because these are all happening inside of yourself. And ACT, we really work to alter the context of those internal experiences while promoting value worthy behaviors. And more specifically, ACT works to change the relationship to internal experiences rather than changing the internal experiences themselves. We'll kind of walk through a brief example of that. So if we kind of think about this workshop that I'm hosting, during this workshop and even leading up to it, I was having this thought of you will embarrass yourself during this presentation. And when this thought would show up for me, I would have a lot of fear thinking about this thought. I would also be very annoyed by this thought. I would also be very disgusted and angry. And if I'm having all these strong reactions to these thoughts or to the specific thought, it makes sense that my one internal reaction to this thought would be to run away from it. So in ACT, we are not going to change the thought itself. We will change the relationship that we have with the thought so that that relationship is neutral. And we really go about this by working with the client's psychological flexibility. Another word I really like to think about psychological flexibility, and pretty much like a definition of it, is staying present with internal experiences while living a valued life. So if we kind of even go back to my example, you will embarrass yourself during this presentation. Having that neutrality allows me to stay present with the thought so that I'm not running away from it. So I'm not trying to ignore it. So I'm not trying to change it. And so, yes, we work on a client's psychological flexibility so that they can stay present with internal experiences while living a valued life. Now, we go about this using 6 processes, kind of going clockwise from the top. We start with contact with present moment, then we have values, then committed action, then self as context, then diffusion, then acceptance. And to give like a very, very brief definition of all these things. Again, starting with the top of contact with the present moment, that's just mindful of current reality. Then we have values, which are principles that guide your life. Then we have committed action, which is actively participating in your values. Then we have self as context, which includes separating yourself from your consciousness. Then we have diffusion, where you're viewing your internal experiences for what they are. And of course, last, we have acceptance, is having a non judgmental stance towards your inner experiences. And yeah, all this kind of sums up, as I mentioned, on allowing a client to be psychologically flexible, meaning they're able to stay present with this internal experiences while living a valued life. Now, when you're working with clients, sometimes you may not have time or resources to really dive deep into each 6 processes. So these processes can actually be split up into 3 pillars. And the two that we will be talking about today are the open and aware pillars. So with the open pillar, we have acceptance and diffusion. With diffusion, I actually want to start here. If we think about our brain is always running. It's always giving out ideas. It's always sharing opinions. It's always just free flowing. Excuse me. It's always just going. And the one thing is, it has an opinion about everything. It even has an opinion about our thoughts. Again, if we kind of think about, let's see, if we think about this example that I gave, in this case, it had an opinion about this thought, which include annoyance and even anger and even disgust. So yes, our brain is always flowing. It has opinions. It will even try to opinionate the things that we experience, our internal experiences. And so with diffusion, we're asking clients to see if they can remove that subjectivity from their inner experiences and notice that these inner experiences are simply signals being sent to the body, informing us about our environment. The way I kind of think about, if we think about diffusion in the other direction of like being fused with our inner experiences, often clients will come into therapy labeling their anxiety as bad. Now, when that happens, it's very easy to see that the client has set up rules and parameters to their anxiety. And because it is bad, it means it cannot be present. They cannot experience it. It's funny, they've kind of generated a rule for it. And sometimes that rule is generated from, uh, cultural influences, societal influences, even some biological influences. But again, it's that development of a rule being that anxiety is bad. Because it's bad, it can't be around. So then clients will do whatever it takes to get rid of that bad anxiety. We can also think about it in another direction in terms of some people view anxiety as good. I kind of think about it as like people who like to skydive, base jumping, even like driving really fast. They kind of like that adrenaline rush that anxiety offers. So they're actively seeking it. But when we ask our clients if they can participate in this diffusion, it's like, okay, can we remove the subjectivity from those inner experiences and say, I am experiencing anxiety, rather than saying, I have anxiety. Now, with acceptance, acceptance is, sometimes people get acceptance confused with tolerance. And it's funny because tolerance includes parameters. It includes parameters and rules. And that is not what we're asking our clients to do. And if we want to get more specific, um, we're asking our clients if they would be willing to accept the internal experiences when they show up, not the content. I think that's very important to highlight, especially when you're working with clients with PTSD or OCD, because often they'll have images that are uh, very disturbing to them, whether it's something they've experienced or it's simply just a disturbing image. So, if we want to take that for an example, we're not asking clients to accept these images, to accept these thoughts. We're asking, could you accept that they've shown up? Are you okay with them being here? Could you have a non judgmental stance towards these thoughts, these feelings, these images? And of course, these two things take a lot of work of walking through with a client. But yeah, I think of acceptance. Another way I think of acceptance is kind of just letting something be. Here in Utah, there's a lot of hikes. And so, you don't see a lot of people really messing with the nature on these hikes. They kind of view it, they enjoy it, or maybe they don't enjoy it. And they just kind of let the nature be. Um, and so that's how I like to think about acceptance too. It's like, can we let something be? We don't have to remove it. We don't have to mess with it. We can just let it be and just go about our life. Um, and now on to the next pillar. We have aware. With aware, we have contact with the present moment and then selfish context. Contact with the present moment is really kind of exactly what the label is asking us to do. Just being present in your reality. Some people kind of view this as being mindful of your reality, and yes, that also makes sense as well. But I think it's another way of saying, can you not get caught up in your thoughts, in your inner experiences, and can you bring your awareness to what's going on in front of you? Often I talk to clients about being present in the sense of um, like a spotlight, because our attention could be in our head or our attention could be what's in front of us. And so often I'll ask my clients like where their spotlight is during session. Sometimes their spotlight is in their head. And then I kind of walk through them. It's like, okay, how's that showing up for you? And then ask them like, is this interfering with our ability to have this conversation? And most of the time it's like, yeah, it's difficult to concentrate. And then I ask them, okay, can we move that spotlight to what's in front of you, to what's outwards? Um, there's a book by Steve Hayes called Get Out of Your Mind and Into Your Life. And honestly, I think that is a good a good title, but also a good title for contact with the present moment. Can you get out of your mind and into your life? And now the selfish context. The selfish context is one of my favorite processes as just like personally. And sometimes I really like to walk through this with clients. And I know it can be very difficult at times to really digest this process. But if we kind of go in this direction of um, of understanding that our brains are always flowing, our brains are always flowing, they're always going. And so we have no control of what shows up. It's the same idea as, yeah, our brains always have an opinion about something, but it also has a feeling about something. It also has a thought about something. It always has an emotion about something. Our brain is constantly processing the environment and then spitting some information out to us in the form of thoughts, feelings, emotions, and physiological sensations. And us as a person, because we can't control what our brain spits out, we have to do something with that inner experience. Whatever thought it delivers to us, we have to do something with it. Whatever emotion it delivers to us, we have to do something with it. And so, really, self as context is understanding, can you see the difference between your brain and yourself? Your brain is sending the signals, and it's the separation of the brain and the self. Some people like to say the soul and the self. Some people like to say the mind and the self. But it's understanding, can you understand these differences? Can you kind of go in the direction and state that I am not my inner experiences? I am merely a body that experiences feelings, thoughts, and emotions, and even physiological sensations. It's that separation. I really like to think about it. We're kind of going this in this direction of I'm a body that experiences feelings, thoughts, emotions, and physiological sensations. I kind of think myself as a vessel that is being fed information of my environment through my brain. And like I mentioned, this concept can be very difficult to really understand. Um, a lot of books will write this topic as kind of like stating you are not your thoughts. And that is correct. That is absolutely correct. But I just wanted to give some more depth to that as why we come to that conclusion of stating, I am not my depression. I am not my anxiety. Because at the depth of it is understanding that I'm a body that experiences depression. I am a body that experiences anxiety. And sometimes you can go in the direction if you've been talking about labels, um, identities, things like that. But I really wanted to provide a very specific, in-depth um, explanation of selfless context, just because I do feel like it can be difficult to comprehend, and sometimes it can be difficult to find that information as well. Um, Another thing about selfless context is sometimes people have kind of mentioned to me, like other therapists, they've mentioned it took them several tries in terms of like resources to really comprehend this concept. Um, but it was also a lot of experiential moments within themselves that they were like, I understand this now. Okay. And yeah, so when we're kind of thinking about these two pillars, these are two pillars that, yeah, you can really work with your client. And sometimes they help you kind of comprehend what we're doing in acceptance commitment therapy. We're trying to change our relationship with our inner experiences. And we can really do that sometimes just using these two pillars. Um, Another thing I want to kind of like discuss is that um, sometimes people like to use the specific vocabulary within acceptance commitment therapy. They like to tell their clients, talking about, we're going to do a diffusion exercise, or could you diffuse from that thought? And that is completely fine. There's nothing wrong with that. But I also want to let you know that you don't have to use that exact verbiage with your clients. I think it's important to teach them the concept. And if they find another word, I would say stick with that word. Or if you kind of find another word with them, just roll with it. There's nothing wrong with kind of moving away from this very specific verbiage in terms of like diffusion, acceptance, self as contact with the present moment. Often, I don't think, I'm trying to think about it. I don't think there's ever been a client where I've even mentioned the word diffusion. Um, I've used the word acceptance a handful of times with clients, and even that, I don't always use the word acceptance. I kind of, yeah, I just roll into the definition, asking them, would they be willing to have a non-judgmental stance towards their inner experiences. And the same thing with self as context and contact with the present moment. Because, yeah, what's important is that they're learning the concepts. So the verbiage and the specific names and words that you use to get there, um, that's not always important. Um, okay. I did want to briefly review a mindfulness exercise that you can do with your clients. Um, with this mindfulness exercise, this is something I've done with numerous clients. And so what we'll be doing, I will actually kind of teach you this as if I'm talking to a client, and then we'll also go through it as well. Um, what I want you to do during this exercise is just notice. I'm going to ask you, we're going to scan your body and then kind of go inside and see what's there, see what thoughts are there, see what feelings are there, see what emotions are there. And all I want you to do is just notice. If you start getting hooked on a thought, if you start engaging with a noise outside or even something you're sensing in your body, I want you to notice that you're sensing that. And then just be gentle with yourself and letting that go and then going back to noticing. And that's it. And then, of course, afterwards, we will debrief. At least that's what I tell my clients. Okay, we don't have a lot of time now. We'll spend about 3 to 4 minutes. And this is also just to give you an example of how I go about this with clients. Okay, everyone go ahead and get comfortable in their chair or their couch or wherever they're at. And just kind of let loose. And then I will ask everyone to close their eyes. I will keep my eyes open, maybe for a brief time, but that's just to keep track of time. I want everyone to go ahead and close their eyes. Just close them ever so gently. And then I want you to just hear the noises outside and around you. What noises are showing up? I want you to be aware of everything. Do you hear something next door? Do you hear something outside? Do you hear something inside the room? Just notice it. That's all we're doing. And just go back to noticing. If you hear sirens or an AC unit start off, that's okay. If you get hooked with it, that's okay. Just be gentle with your mind and come back to noticing. Come back to noticing. Now we're going to be gentle with our awareness and our attention, and we'll slowly move our attention to our feet. How do your feet feel? Are your shoes tight? Are your socks sticky? Cold, warm, just right? What do you feel there? Just notice it. Nothing more, nothing less. And then we'll move up to your legs. See if you notice any sensations there. What does the chair feel like you're sitting on? Or the ground? Just notice it. Then we'll slowly move up to your chest. You can notice your breathing. And then your back and neck. Is it tight Are you hunched over? What do you feel? And then your jaw. All you're doing is noticing, nothing more, nothing less. And then I'll ask you to go inside your mind and see what's there. If you get hooked on something, that's okay. Just be gentle and go back to noticing. If you're getting stuck on something, a thought, or even a sensation, a physical sensation, that's okay. Notice that as well. All you're doing is noticing. Continue to notice. And then whenever you're ready, you can go ahead and open your eyes. And after I do that exercise with clients, I often debrief with them. So that includes asking them how that was for them. Um, and I'm very explicit with my clients and making sure to tell them either before or even after of like the point of this exercise is not to feel better at the end of it. The point is to simply notice what is going on inside. And um, even when clients are debriefing with me, I'm asking how it went for them, if they got stuck on something, or if even they noticed something new. I ask, oh, what was that like noticing that? And as you can see with this exercise, it's really working within these two pillars. Let's see if I can bring that back up. This exercise specifically is really working within these two pillars of being aware of either sensations or thoughts or feelings or emotions, and then also being open. So that's where I ask them, can you disengage and be gentle and go back to noticing? It's the same concept of letting something be. And usually, this is honestly where when I debrief with clients, this is where I can really dictate which direction I can go further with them. Because often after this exercise, I ask the clients what they experience, and they kind of either tell me like, "Oh, this is very new for them," or "This was very overwhelming to like hear all my thoughts and things like that." So in my head, I'm like, okay, we're clearly in a space where just being aware of our body is a lot of work. So that's somewhere we can go. Or if a client mentions, oh, I had a thought about my meeting I have after this session, and I'm very anxious about work, then okay, in my head, it's like this is a place of being open with the client that we can go in. So I kind of use the debriefing with the client after the exercise to really see what shows up for them and kind of like which direction I should take with them next, whether it's being more aware or being more open. And that's why I really like this exercise because, yeah, it's yeah, kind of guiding me with the client of where they're really struggling. Now, another thing with this exercise is that I actually ask the clients, especially if they don't have a lot of experience with it, to do this between sessions, almost like a homework. And I'm very explicit with them on why I want them to do this. And so what I say is like, we want to build this foundation of these skills. And so, if I'm more explicit, I'm saying, uh, like being aware of what you're experiencing or being aware and being open to what you're experiencing. So we want to build a foundation of these skills. We want to build a foundation so that when you do it in a very controlled environment, it's very easy to do. And then when you get really good at it, you can start applying these specific skills of being aware of what you're experiencing into your everyday life and building these skills of being open and seeing if they can implement it in their everyday life. Therefore, they can be, you know, they can be aware of their anxiety when they're in a social setting, if they've been working with their social anxiety and saying like, okay, is this a place you can be open with it now? And being like, okay, yeah, you've built these skills. Now let's use them in everyday life. I really think of kind of like how I use this exercise and even other act related exercises as very similar to I don't know if people are remember the Karate Kid, the first Karate Kid, where the master asked him to always like wax his car, and then finally he got fed up and saying like, "Why are you having me wax my car?" And then he kind of went through it where he tried to hit him, and then he did like the wax on and did the wax off and was able to deflect. But I kind of think of it as the same concept. It's like we're doing these skills in a very controlled environment so that way we can do them in your everyday life. Sometimes I even tell them about that scene in um, Karate Kid just to help them understand, yeah, specifically why we are doing this exercise. Um, but yeah, I think that is it. I would like to thank everyone for coming in, and we'll kind of move on to the Q&A portion. Yeah, feel free to put in the chat if you have any questions. Um, if you want me help, uh, if you need me to explain anything further or uh, have more specific questions about anything we went over. Ah, yes, the limitations. When I think about the limitations of acceptance commitment therapy, I actually think about it in the context of working. So if we kind of think about, okay, we're changing our relationship with our internal experiences. But if there is a outside environmental issue that is causing, us to be angry, to be upset, to be sad, then that's where I kind of say, act isn't the best thing. So this comes in the form of, racial discrimination, any form of discrimination, honestly. Also, if there is a threat to the client's survival, and this doesn't always have to be physical. This can be in the sense of financial. So, like if they're going to lose their job, um, or if um, and so yeah, I think about like outside forces seriously causing them harm and changing their internal experiences. Um, that's where I kind of think there are some limitations to acceptance commitment therapy. Now, it doesn't mean you can't really kind of use acceptance commitment therapy or some of the processes um, to really help the client figure out what they want out of life in that situation, or to even help them get the ball rolling in terms of like problem solving, or even, um, just helping them grieve or whatever it may be in the immediate moment. But yeah, big picture, outside forces that are harmful to the client. Okay, strategies, interventions. So this context. When it comes to strategies to help uh, the client understand or apply self as context, one one exercise I like to do that is really invested in labels more than anything else is doing I am statements with the clients. So I have the clients write I am, and then have them write out like different hats that they wear, even reflections about themselves, whether the client says, I am reserved, and kind of explore that with the client. Like, how has that been working for you? I had a client that mentioned that they actually don't like that they're reserved. They want to be more outgoing, but their anxiety is interfering. And it's like, okay, we can work with that. We can work with that. And then kind of going through this idea that we don't have to always stick with that label. We can be flexible with some of these labels. Intellectual developmental disability. That's a good question in terms of using these techniques with someone with an developmental disability. I actually don't have a lot of experience with working that with that population specifically. Um, I do know there have been some people that have attempted ACT with people on the spectrum. I also know I know using ACT with caregivers, with people with intellectual and developmental disabilities is pretty common. Um, but in terms of using this for this specific population, I actually have no experience with that. Okay. I will leave the chat open to for people to ask questions, but I also wanted to put in the chat the yeah, the link for the CE credit. So let me see if I can do this. So yes, this is if you would like your CE credit. I would ask that you fill this out completely. That way we can make sure that you get the CE credit for attending this workshop. I hope that copied and pasted correctly. And let's see. But yes, if anyone still has questions, you're welcome to put that in the chat as well. Awesome. Sweet. And then while that link is still in the chat, we have another evaluation for everyone to fill out. This evaluation is just to help us um, help us with like making things smoother or even like improving some aspects of the workshop, so that this experience for everyone can be better in the future. This does not have to deal with the CE credit. It is simply the link in the chat is for the CE credit. This is just for us, the QR code. But we'll hang around. But that is everything we have for the day. I want to thank everyone for showing up. Uh, Thank you for spending your break, your lunch, whatever it may be, with us. Um, Again, I appreciate everyone showing up, and I hope everyone has a great day.